So whenever you think for osteomyelitis, you should think for what? Staph aureus. Okay. And in the lecture also I've told you that this is the most common bacterial cause of the acute osteomyelitis. The answer is what? Staph aureus. Okay. However, the vertebral osteomyelitis in the adults may be caused by, in India, Mycobacterium tuberculosis, which is also termed as what? Pott's disease. Okay, which is also termed as what? Pott's disease. So this is also to be focused upon. Fine. Then the osteomyelitis in the patients with hip or knee prosthesis, nowadays very common stuff, likely to be caused by staph epidermidis. And can you tell me what is staph epidermidis? This particular fellow is a cons. Okay, this particular bacteria is what? It's a cons. And what is cons? Coagulase negative staph. And why does it does this in the hip or knee prosthesis? Because this is forming up biofilms. It will adhere up to these surfaces and leads to these all problems. So one of them is staph epidermidis and another one is a non-sporing anaerobe. Okay, if you see up the last of the bacteriology, you will see up a word Propionobacterium acne, which is a non-sporing anaerobe gram positive. Okay, obviously as the name suggests, it does what? Acnes and all, but here also it have a role to play and cause what? Osteomyelitis. So in total what we have learned, that the acute bacterial osteomyelitis is done by whom? Staph aureus, the most common cause. In the vertebral, you should think for whom? Mycobacterium also, that is Mycobacterium tuberculosis, Pott's disease. Whereas in those who have undergone what? Hip or knee prosthesis, what is important? Staph epidermidis or Propionobacterium acne. They also play the role in causing up what? Osteomyelitis in patients with hip or knee prosthesis. Okay, this is there. Now coming to your favorite diabetics, just now we have talked about them. They have what? Vascular insufficiency or arterial insufficiency in the lower extremities, and that is a cause to cause what? Chronic infections and the skin ulcers. And these infections can extend into adjacent bone, causing osteomyelitis. This is like repetition of the stuff. Now, the staph aureus and the skin anaerobes, like just now we have done, Propionobacterium acne, they are often involved. They are often involved in causing up the problem in the diabetics. Okay, when the osteomyelitis occurs in an intravenous drug abuser, okay, intravenous drug abuser, it is again most commonly caused by the staph aureus. It is again mainly caused by whom? Staph aureus. However, some gram-negative rods such as Pseudomonas, Serratia, which is a Enterobacteriaceae member, Serratia marcin, which have this particular producing pigment also pinkish, okay, and certain yeast like Candida. Okay, so Candida is yeast like. They are also important causes of what? The osteomyelitis in an intravenous drug abuser. Okay, if anybody takes up intravenous drugs and all, still the main agent will be what? Staph aureus, accompanied by whom? Pseudomonas, Serratia, and the yeast. Okay, certain fellows will tell you Pseudomonas and all, but still in the IV abusers also, what is there? Staph aureus. Okay, now you tell the answer of this particular question. The osteomyelitis following a puncture wound of the foot through a sneaker is often caused by what? Which organism? So remember, the answer to this question is Pseudomonas aeruginosa. Okay, Pseudomonas aeruginosa, which is obviously producing which type of pigments? Pyocyanin and pyoverdin. Okay, so that is in this particular question. Okay, the cue which I'm marking up are very important. Definitely you will find somewhere. So osteomyelitis following a puncture wound in the foot through a sneaker, that is often being caused by whom? Pseudomonas aeruginosa. Now you tell the next one. The osteomyelitis associated with the cat, or even you can add here the dog. Okay, the cat and the dog bite. The answer is Pasteurella multocida. And the Pasteurella multocida is what? It's a gram-negative bacteria. It is what? It is a gram-negative bacilli. Okay, what it is? It's a gram-negative bacilli that you already know, and this is frequently being asked also. That the Pasteurella multocida associates with what? So remember guys, this associates with what? Cat and the dog bites. Okay, this associates with what? Cat and the dog bites. Definite question. This is a definite question, and again I'm marking up Q here. Now, another favorite question. The patients with the sickle cell anemia, okay, the patients with the sickle cell anemia, they are predisposed to the osteomyelitis caused by what? Salmonella species. Okay, so this you already know that it's a infection which is post typhoid also, and the salmonella species like typhi and all they involved up, and they does particularly in these sickle cell anemic fellows what? Osteomyelitis. A definite question of INCT exam. Okay, a definite question of INCT exam, that the patient with sickle cell anemia, they are predisposed to which particular thing? That is the osteomyelitis caused by which particular organism? Salmonella. And salmonella is what? Gram negative or positive, guys? So this is a gram negative bacteria belonging to which particular family? Enterobacteriaceae. Okay. Then coming to the fungus one, that is the fungal osteomyelitis. And the fungal osteomyelitis, I've told you, done by whom? Coccidioides and the histoplasma capsulatum. Okay, so this coccidioides, which this particular name, coccidioides, it is what? It is a dimorphic fungus which leads to a dimorphic disease termed as what? Coccidioidomycosis. Okay, and histoplasma capsulatum leads to histoplasmosis. Okay, and histoplasmosis is also termed as what? Darling's disease. Okay, or Cave's disease. And this question was asked in the FMG exam, that which type of macroconidia seen. So here only I will cover up certain aspects which you can remember for your exams. Tuberculate macroconidia. They have shown up the picture of tuberculate macroconidia and they have asked up that which particular fungus is involved. The answer is histoplasma capsulatum, which also mimics tuberculosis. Okay, which also mimics tuberculosis. This particular histoplasmosis, also termed as Darling's disease or Cave's disease, and it's a dimorphic fungus having this tuberculate macroconidia along with the narrow-based budding yeast cell. Coccidioides, it is having an arthroconidal arrangement, okay, and it associates with certain fevers, if you remember, St. Joaquin Valley fever, desert rheumatism, okay, these words, they are also being asked in the Viva and in your INCT exam. So they are involved up in causing up, after the pulmonary infections, the bone infections also. And that's why what we are telling up, the fungal osteomyelitis is done by these two important dimorphic fungus. And what is the dimorphic fungus, guys? Which is having the yeast as well as the hyphal form. Yeast at which temperature? 37, and the hyphal form at which temperature? 25. Okay. Now that you already know. This is an important statement, that the viruses, protozoa and the helminths, they do not cause osteomyelitis. Okay, they do not cause what? Osteomyelitis. Which particular fellows? Viruses, protozoa and the helminths. They do not cause osteomyelitis. Important to remember. That's why in the starting only I've told you bacteria and the fungus, they are mainly involved in causing this. But the immune complex ones, they are being done by viruses also. That is also there. But mainly in the osteomyelitis stuff, we need to focus upon bacteria and the fungus. Now there is a table which you need to have a look at one go, and the questions will be in and around that only. So you just have a look over this particular table and it will help you to remember the various organisms and their